Posso andare, prego?
Sì, sì.
Buongiorno, benvenuti alla conferenza stampa conclusiva del G7.
Good morning. Welcome to this final press conference. Let me call with no further ado the Minister Orazio Schillaci. Thank you very much, ladies and gentlemen. It's a pleasure to be here in Ancona. Let me thank all the citizens of Ancona that have had to bear the brunt of the confusion that this event has created to the city. It's been an honor to chair this G7 meeting. I'd like to thank the Italian delegation, the region of the market region, the municipality, and all the national and local authorities that have attended. My thanks also go especially to many international colleagues that have been with us. Alongside the G7, we invited countries such as Albania, Saudi Arabia, India, and South Africa, and several international organizations, WHO, FAO, and OECD. This is an important point. We are convinced that only with bilateral and multilateral cooperation is it possible to meet the health challenges that we have to tackle. The health of the planet is a huge ecosystem. Environmental health and human and animal health come together, and only if we jointly tackle these can we prosper. It has been a year of intense work. A joint communiqué will shortly be presented on the ministry website and the health ministry website. It brings together all the topics and leads to conclusions on what topics we've been discussing. We've discussed the issues that impact our lives, and we have started providing some answers. The AMR in particular, this antimicrobial resistance is a terrible threat, and it threats several of the achievements and the new therapies that we have today, which were not with us some 2 years ago. This is the real emergency. I read in the press that there are new pandemics, and one of them is AMR. We have to tackle it together, considering that there's a huge number of casualties, especially in Italy, related to hospital infections and resistance to bacteria. This means this is the result of inappropriate uses of antibiotics, and this imposes concrete actions. This is a silent war. It can be fought in laboratories, hospitals, but we have to also use new weaponry to meet it. Yesterday, in the finance ministers' meeting, Italy announced $21 million of investment and a partnership, a non-profit partnership for developing new weapons against these agents. This is a concrete choice and option. Goals cannot be achieved without financial resources, and so it is with this choice that Italy is at the forefront alongside the other G7 members in seeking new solutions to manage the crisis of AMR, and these are part of the push initiatives to encourage investors with government support, financial and technical, for finding resources. And we're also convinced that we have to work on pull incentives to make the market attractive and encourage private entities to invest, which enable a return on their investments once the pharmaceuticals can be marketed. And we're thinking of using a part of a fund that exists for oncological innovative drugs alongside the non-oncological ones without penalizing the fund. Now, this fund provides guarantees such as access by all regions and the payback mechanisms that has to be implemented alongside IFA, which requires restructuring, and the Matei plan for Africa presented by this government at the beginning of this year, we are engaged to sustainable development for pharmaceutical manufacturing in Africa. Alongside this G7 meeting was the topic related to active aging. This is a global issue and not just for high-income countries. We have to review the health care systems. We have to focus on sustainability, and there has to be tailor-made medicine in organizing therapies closer to the needs of citizens to meet, therefore, the challenges related to the aging population. We have two very important tools: prevention and innovation. Prevention must be conducted throughout the life cycle. It's a long-term investment. We have to change gears. Investing in prevention is not spending. And this means, in the long term, having a well-being with active lifestyles, and we have to focus on food habits based on products that we have in Italy. And we must remind all to have constant and regular screening. This is key, not only for a longer life, but to guarantee that a universalistic healthcare system such as ours, of which we are proud as a country, and there are several compliments I received from foreign delegates for the quality of our healthcare system, but we can't think that a healthcare system, universalistic as it is, with an increase in the average life age, can be sustained if we don't invest in prevention. The other resource we have available is innovation. Innovation is necessary to meet the economic and social challenges of the Italian population, which is increasingly elderly. The impacts of disability of patients can be helped with remote medicine, remote assistance, distance monitoring. This will enable us to go beyond the architectural, economic, and geographic barriers and provide better access to therapy, especially close to one's domicile. And then prevention and innovation are the keys for a more healthy future, for a new spring in life where technology and health go hand in hand. So we must enhance the opportunities that technology provides. I'm referring to robotics and also AI, which we discussed in the conclusive session this morning. So this has already begun to change medicine and improve our diagnostics and therapy. AI should not be contrasted and feared. We have to have an ethical approach towards it and remember that no technology can replace human actions and decisions, especially in the medical field. And therefore, on this such an important topic, our chair produced another significant result. For the first time, the G7 members approved a policy brief on AI and health, which shall be published as an appendix to the ministerial communiqué. Let me lastly thank the press for the attention they have devoted over the past 2 days to the Health G7, and I'm here available to answer your questions. Thank you very much, Minister. So Gerardo D'Amico from Radio 24 is the first member of the press to ask a question.
Thank you. Good morning, Mr. Minister. I'd like to know, if possible, what are the real intentions of the great ministers of G7, but also the other countries you've invited, to be able to invest in what you said with the funds? Is it really possible to have a change in step? Today, it would be possible to eliminate certain things from the world. There's a new retroviral drug that will help us to not have infection who come in contact with certain virus. It costs 18,000 euros, and only 13% of Brazilians where the disease is widespread have it. we, in the first 2 years of pandemic, we spent 19 billion euros for health. A vaccine cost 22 euros. However, Altems tells us that to hospitalize a COVID patient today costs between 900 and 25,000 euros if he's in hospitalized. So since you talk with the financial ministers, 21 million for AMR is fine, but here we're talking about other costs. Thank you for this question. There was a very important session with the ministers of finance of the G7 ministers. We continue to finance, and we promoted the pandemic funding, and we will continue to do so. Innovation and research live thanks to funding and finance, and that's the best thing we can do to bring health to all continents. I'm talking about Africa, the support we're giving to Africa, and the production of new medicines in Africa. This is a clear intention of all the G7 countries, something we will be facing in 15 days' time in the G20 hosted by Brazil. And when we talk about a global health architecture, another subject which we dealt with during the G7, we don't want to leave anyone behind, because that's the message, because the recent pandemic showed us how important it is to have health and well-being, and this can only be ensured in all continents of the world, especially those countries that have lower-income countries, because viruses don't need a passport to go from one country to another. So I believe that truly we have the will to proceed in a work that has been started, and antimicrobial resistance, together with the One Health approach, which we discussed a lot, will represent the right vision to have a modern medicine up with the times. We all have to know that man's health is connected to animal health and also to the health of our ecosystem that surrounds us all. And on this, we had an important session devoted to climate change, which must not be underestimated. We have to have a holistic vision. We have to have an idea of a modern kind of medicine that offers innovative therapies. And on the other hand, we have to be able to have a sustainable kind of medicine to leave no one behind. Next, colleague Mario Zandari from Radio Rai.
Good morning. The Italian chair has also been an opportunity to promote, as you mentioned earlier, food model alongside the strengthening of the healthcare systems in Italy is the right combination for aging well compared to a global population which almost everywhere has seen an increase in life expectancy. I think that active aging is one of the topics that we tackled, and as you quite rightly said, we heard from younger countries such as Brazil or Saudi Arabia that has a huge number of their population under 30. Everyone is realizing that life expectancy is growing. So it's not a question of living longer, but rather it's a question of living a better life as we age. No healthcare system, universalistic such as ours, of course, too, cannot exist if we don't reduce the number of patients requiring therapy. So we have to focus on the right lifestyles. And we have the Mediterranean diet that I call Italian, which is a dietary model which is appreciated globally, maybe not followed as it should be in Italy. So a correct diet and lifestyle are key and should be taught from the very early ages in infant school in order for citizens to become more aware and therefore then choose for medical screening that may therefore reduce cases, cancer cases and so on. This is a global challenge alongside the antimicrobial resistance issue, and I'm happy to see how important it is for younger countries to realize how important it is to invest in prevention from very early stages. Mr. Marzio Bartoloni now. Mr. Minister, good day. You mentioned the budget bill, and Minister Giorgetti right now is looking for the coverage for finding resources for the requirements, the necessary requirements. You must have mentioned this, and the personnel and employees of the healthcare system. You have mentioned often that there is a need for hiring new medical professionals, from doctors to nurses. So could you give us some more detail? In other words, how many doctors and nurses do you count on hiring, hoping that Giorgetti provides the right funds in the budget? So what are the figures for this plan? As I have often said, the requests we made this year to the finance minister are addressed mainly at concerning personnel, as you say, the hiring of new medical operators, including those who already work in the healthcare system, and their role has to be enhanced and valued. We have to hire more people in the public sector. We have a plan for this. If you look at the OECD data, which represent 39 countries and not just European countries, you realize that what is missing in Italy is nurses rather than physicians, and that's an important element. Over the next 3 years, bad planning previously has led to this shortage. I was the dean of a medical faculty, and I noticed in that position that we saw a dwindling of the number of students attending medical faculties, medical departments over the years. Young physicians are no longer choosing certain specializations. This is not an Italian issue. That's another aspect. Often the press highlights Italian challenges, but physicians choose not to practice certain specializations, not just in Italy, but elsewhere too, because they are considered professions that don't enable them to be freelance professional. So I believe that what the requirements are concern mainly for nurses to implement territorial medicine, and much of the PNR investments are focused on that. We need to hire physicians for some professions that are not covered. With Minister Giorgetti, we try to work out how we can provide incentives to those young who to choose certain specializations which are not totally covered. And we conducted a campaign in our ministry this year. The number of physicians that joined qualifications for emergency rooms have increased. And of course, it's something that must become something of awareness that physicians can't just be missionaries. It is at the same time true that they can't expect to earn a lot of money just because they are physicians. It's appropriate to earn what is appropriate but being a medical professional has to comply with other values and not just the pay. We shall be hiring nurses and doctors, and at last we shall be able to put an end to this ridiculous phenomenon of spot hiring, people that work with completely hired in the various departments where they work. They are often working crucially important positions such as the emergency rooms, and then those who won the public competition earn less than what the others earn.
Francesco Maggi, compliments and congratulations for this event. I want to go back to the pandemic. Often I've asked you this question when we met at various events in the past. Is there a date for the official presentation? And is it the draft that came out in March or April? Yes. Yes, of course. We're working to refinance the necessary resources. The regions have asked for an economic resources for the pandemic plan, and we will do this in the state region conference. And it's going to be a modern pandemic form, and it will look to all sorts of emergencies. And I believe that in the Finanziaria and the financial law, there will be the resources to approve it and to render it available. Thank you. Emanuel Correra from Lazio. Good morning. Minister, this G7 saw the participation of India, South Africa, and many other guest countries, and so it was open to these lower-income countries. And in the last few months, we had contacts with several of these countries, among which India, to try and open the basin of professionals, nurses, going to these countries. And we had the Indian representative here. Have there been steps forward made for this project? And then you also talked about the lack of doctors. Now, general physicians have announced strikes, asking for more funds for medicine on the territory. Yes, yesterday we had a bilateral meeting with the Vice Minister of India of Health. She was present here. And we defined the final operative way of coming to a protocol, to drafting a protocol. And the nurses that will come from India to Italy have to learn Italian first. And there will be an online platform of courses made by the various universities here in Italy. So we are still defining this. The fact that nurses are missing, they're missing all over Europe, they're missing in the US and Japan. And even before other nations, we've identified India because they have diplomas that are of quality, and they can be recognized by our system, academic and hospital system. These are people who have also already been employed in Italy many times. And there are many quality people in India. So in the short term, we'll have this protocol. It will become operational, and it will allow us to be able to fill in the lack of nurses that we have here in Italy. So we have to look to the emergency, and we have to take people coming from outside our country, but we are already working so that the nursing profession can become more attractive. In Italy, the last places of the OECD has to do the number of inhabitants. You talk about the strike of general physician. If you look at the OECD data, the people are paid less, are not so much doctors, but nurses. So we have to look to this category that asks for economic incentives and professional recognition. nurses today all have a 3-year diploma, and plus some are specialized, and they have been studying even for 5 years. And so modern medicine need them more even 50 years ago. And in the terms of general physicians, we are available to meet them. I've always said, and I always defended them always. They are the people who know their patients best because they are working on the territory, but we have to face this problem in a different and more modern way because the general physician that used to be in his office all alone today, I believe, is no longer something that is up to date with the novelties of today's medicine on the territory, and especially what young physicians want. Last question, Damiano Fedeli, GR Marche. Microphone. Good morning, Mr. Minister. You talked about a One Health approach. I'm thinking of the territory of the Marche region. What is the model, in your opinion? Should we use that of a few hospitals in big centers, or a more capillary network widespread on the territory? Well, I'd like to say that we've chosen Marche, the Marche region, apart from the fact that it's a lovely region, but the University Hospital of Ancona for the last 2 years has been awarded and classified as the best public hospital in Italy. It's an excellence present on your territory. And I've underlined this to our foreign guests, and they asked me why we came in this beautiful city and region. And the potential enhancing this territory is important. We are working to invest with the investments of PNRR. The Marche region is strengthening territorial assistance. We have to have a balance between the territory and the hospital. In Italy, in the last 10 years, many hospitals were closed down, but the territorial kind of medicine never started. So we saw that when citizens can't find answers on the territory, waiting lists start becoming huge, and the emergency wards are invaded. And so we have to really find a solution to all this. And under the guide of President Acquaroni, this region found the right correlation between the territory and the hospital. It's not a question how big hospitals are. It's a question of finding a balance of the system. I fully believe that the Regione Marche is doing well. It's going in the right direction and offers citizens a quality medicine and close by. Thank you, Mr. Minister. I thank all the colleagues for the great collaboration. We worked a lot, and we're going to close this press conference. Thank you all.